All right, so Micah Parsons has a facet joint sprain, and they said that he had this actually before he was traded. They said that he had a back condition. Everyone thought he was exaggerating because of his trade discussions, but it turns out he actually does have a facet joint sprain. So that puts his status for this upcoming week against my Lions at risk. And as much as I'd like to say that I don't want to see him out there, I do want to see him out there. I want us to beat Green Bay at their best. Talk about what a facet joint sprain is. So basically, it's a part of the spinal column. The facet joint is this region right here, and then you have this capsule of cartilage that encompasses it. A facet joint sprain is when that area, either due to a direct hit or due to a repetitive extension, flexion of the spine, gets inflamed and aggravated. You've probably heard about a facet joint injection, but actually for a facet joint sprain, when they know what it is, they would likely do an epidural injection, which is what they're talking about here, which is where they pierce that outer layer of the spinal cord and they inject steroid directly into that region. Usually they try and do this when they already know that the facet joint sprain is the cause of the pain and they see broad inflammation happening at that joint. What an epidural and that steroid does is it basically is a super strong relief, and it goes there and it knocks out the inflammation directly at the site of the pain. They already did a steroid pack, which is basically oral steroids, which decreases the inflammation in your body system-wide, body-wide. But when they want an even bigger hit, they do a directed epidural injection. It has questionable benefit, so basically about 50% of patients will see relief lasting about 3 months, but that is user dependent. That's depending on whether they know the definite diagnosis. In this situation, they likely have already gotten imaging. They've seen that there is facet joint inflammation happening at the specific joint. They know it's site to target with the epidural. I imagine that Micah Parsons will get relief from this injection, and he should be out there to face my Lions. And like I said before, I want my Lions to stay out Green Bay at their best.